Ready.
Namaste and good afternoon. Welcome to the Recover series presented by Apollo Hospitals. Dr. Srinidhi Chidambaram here. As the country eases itself into normalcy, it is time to remind ourselves that it is not over yet. COVID-19 dangers still lurk all around us, and our safety is in our hands, even literally speaking, because sanitized hands and not touching your face unnecessarily with your hand are important, as you know too well by now, along with, of course, vaccine and mask and social distancing too. Easing lockdowns only means that we need to be a lot more careful. Post-COVID recovery has now seen to cause some complications too in some people. The Recover series therefore brings you twice a week authentic and pertinent guidance to continue to stay safe post-COVID, and also for those who have had COVID to recover well with complete health and well-being as quickly as possible. Respiratory symptoms were once thought to be the most common symptom of COVID-19, but now we know that many other organs and systems are affected, and the GI system, the digestive system, is one such. The digestive system, they say, is affected because the virus can attack the ACE2 receptors on the intestinal or the gastric cells, or it could be because of damage to the gut microbiomes, or it could be because of damage to the blood supply to organs like the liver and pancreas, so they may be directly attacked as well by the COVID-19 infection and the virus. So it is often seen much more than earlier that COVID-19 patients have a lot of GI symptoms like lack of appetite or diarrhea or nausea, bloating, abdominal pain, vomiting, belching. And these also in the post-COVID scenario are known to persist in people. And these common sequelae include the same thing, the loss of appetite or nausea, reflux, diarrhea. And this is something that we need to identify and understand. So we need to explore this particular topic of what are the gastrointestinal symptoms and issues that can occur in COVID-19 and also persist post-COVID-19, and how we can manage them. To discuss this, I'm very happy to welcome Dr. Piramanayagam, Senior Medical Gastroenterologist from Apollo Hospitals, Chennai. Dr. Piramanayagam did his DM in Gastroenterology at the Sanjay Gandhi Postgraduate Institute of Medical Sciences, Lucknow, and his MD in Internal Medicine from AIIMS, New Delhi, and MBBS from the Government Kilpauk Medical College Hospital, Chennai. He has been practicing at Apollo Hospitals from 2010 and has published an extensive number of research articles, review articles, abstracts, and book chapters. He has also been the recipient of several awards like the IST Cystopic Award at the 49th Annual Conference of the Indian Society of Gastroenterology in 2008. Welcome, Dr. Piramanayagam. It's lovely to have you here at our Recover series. And I'm so glad that you're here to explain to us about all the gastrointestinal symptoms and complications that are possible with COVID-19 infection. Over to you.
Good afternoon. Thank you so much, Dr. Srinidhi, for the kind words. And I'm very happy and thankful to you for giving me this opportunity to interact with you all about the problem of COVID-19. As you have rightly pointed out and discussed in a very brief situation as to how COVID affects the gastrointestinal system. We all know that COVID is, our main worry is about the involvement of the lungs, because that is what worries everyone the most, whether they require an oxygen, they require a ventilator. And last month, in the second wave, we have seen that almost the entire country has been affected by the need for this oxygen, hospital beds, ICU, and so on and so forth. But what probably does not get as much attention about COVID is that it also affects so many other systems. And one of the most common system, apart from the lungs, which gets affected is the gastrointestinal system. And as you correctly had mentioned, that the virus can bind to some receptors in the stomach and the intestines, and just also been shown to persist in the intestinal cells for a much longer time than it does even in the lungs or in the upper respiratory passage. So the manifestations of a COVID have been myriad in the gastrointestinal system. It can present more like loss of appetite, dyspeptic symptom, which we usually associate with some acidity in the form of like bloating, belching, loss of appetite, or vomiting sensation. To the other end, where they have the initial presentation could be only in the form of loose stools. You may not have any respiratory or symptom in the form of cough or breathlessness. The presentation may just be some fever, loose stools, and body aches, just like any other viral diarrhea. So these are what we call as a milder variant of the symptoms. But what is worrying for us as gastroenterologists when we see patients with COVID who do get admitted with COVID or who come with COVID and who present to us in the OP or the inpatient is when they develop abdominal pain. So sometimes what we do notice is that just as people with COVID develop clots in the lungs that we have heard of, there are very high, I won't say high, there's a good chance that sometimes clots may form in the blood vessels that flow into the intestine. And that can cause what we call as an ischemia. There's a reduced blood flow to the intestine, where you have severe pain, abdomen, bloating, vomiting. And we have come across a few patients who had this either during the acute phase of the COVID or sometimes even a few weeks down the line. So that is the other extreme where we have the most serious complication, like a complete loss of blood supply to a part of the intestine. Apart from this, what we do commonly see in patients who are admitted and get treated with COVID infection is that, per se, the virus can also cause some changes in the liver. It can cause an inflammation in the liver cells, and that can cause a rise in some of the blood tests that's done for the liver functions, as we call it. The liver enzymes can go up. There might be a mild rise in the jaundice levels. So in that case, then we may need to sometimes modify the medicines that we give to use to treat COVID as well. So the involvement of the GI system can be myriad, can be mild, or can be severe in the form of blood supply getting blocked, which may require surgery. And in between, the involvement of liver, pancreas can cause us to alter the treatment strategy that is used to treat COVID. I think that overall gives you a bird's eye view as to the types of problems that can come along with COVID infection.
So what are the modalities of treatment of these COVID-19, like gastrointestinal complications or effects? Do they need to be treated any differently from a regular COVID-19 infection?
No, generally, the treatment of COVID-19 infection, again, they divided into different categories, A, B, and C. So that goes mainly depending on their saturations and their vital parameters or the involvement of the lungs and so on and so forth. So the gastrointestinal manifestations may not change the severity of the illness. So the treatment modality more or less remains the same depending on the category. But as I mentioned, if there are some involvement of the liver or the intestine, sometimes you may need to modify the medicines used. Like if there are the liver enzymes, if there's a significant liver inflammation, then certain antiviral medicines used to treat the COVID we may not be able to use it in such a setting. So it may require some minor modifications in the medicines that we use to treat COVID. But as a general categorization into the different mild to severe category, that remains more or less unaffected by the involvement of the GI tract. So that goes more, that the severity is gauged more on the chest, that's the lung involvement, rather than on the intestinal involvement.
What about, you were saying that different organs in the digestive system can get affected. Like you must have seen so many cases in the last 1.5 years. So what is the frequency of different, is it always the intestine, or is it the liver or the pancreas, or what is more likely? And also, are there any risk factors for these kind of complications to develop in some people, but not in others?
Okay, so what we do see, I mean, the community, if you look at like hundreds of people who get affected with COVID, it is seen that about close to about 10 to 15% may have coexistent gut-related symptoms. It may be in the form of nausea, vomiting, some loose stools, or mild abdominal discomfort. So that can be to the tune of about 10 to 15%. The involvement of liver and the liver enzyme abnormalities and other things in hospitalized patients is to the tune of about, say, less than 5%. So, and more than 90% of the times, we don't see a very gross involvement or severe involvement of the GI tract. The other extreme that I told, where you find some blocks or clots in the intestinal circulation, extends less than about 1 to 2% of the entire hospitalization. It's a rather less common or rare complication, but a life-threatening one all the same.
What about people who already have different gastrointestinal issues? So it can be starting from a peptic ulcer to a stomach cancer or a gallbladder issue, or they might already have cirrhosis or Crohn's, any of those multiple disorders of the GI system. Do you see that they are likely to, develop these kind of complications, or they are not connected at all? I mean, are they more vulnerable to COVID-19?
Very pertinent and very nice question. So that has been a subject of interest, and there's been a lot of articles which are coming up, specifically looking at certain subgroups who are already on some specific medicines to bring down their immunity, particularly the post-transplant patients, patients who are on treatment for their Crohn's or ulcerative colitis, the so-called inflammatory bowel disease. So these are people who are already on some tablets to control or cut down their immunity. So the worry for us initially last year was that whether they are more prone to get affected with COVID infection. But what we have come to see in the last 1.5 years is that for some reason, these patients who are at least the inflammatory bowel disease patients, now we have enough data from at least outside the Western countries to say that they are not at any higher risk than what we see the general population. But what we do see is that people who get affected because of this COVID, they are particularly patients who are on those medicines which cut down the immunity. Some of them tend to develop a far more severe disease. So that is one concern. The other thing, as you said, is patients who are on post-transplant, liver transplant, and other patients. They somehow seem to have a little higher risk of developing more severe infection than it is in the general population.
So does this mean that people who are on transplant, post-transplant immunosuppressants, or they're also given for certain autoimmune intestinal disorders, what should they do about not getting infected? Should they then be more careful in their isolation at home, or should they discontinue those medications or check with your gastroenterologists? What should they really do?
The general principles that we understand for COVID, prevention of COVID applies to them, and that has to be much more stringent, like masking yourself, to social distancing, avoiding going into crowded places, unnecessary functions. I think basically social distancing, good masking, and particular attention to hand washing is very important. And the other more important thing that has come up in the last 4 months is the vaccines. And people have a misconception that particularly people who are on the immunosuppressants, they're worried about taking a vaccine. So I think that myth has to be dispelled. People with these are also supposed, and we encourage them to take the vaccines as early as possible to protect themselves against this COVID. And as far as the drugs is concerned, whether to stop those medicines, I don't think we should be. There is no data to show that we should stop the immunosuppressants in people who have not yet developed a COVID, right? And that may actually worsen the basic gastrointestinal condition, for which they are on the treatment. And that can lead to bad outcomes. What they should do is, if they do develop some symptoms of COVID, they should quickly contact a physician who are attending to them, and then subsequently discuss if they have a COVID infection, whether some of these medicines needs to be modulated during the period when they have the COVID infection. But blindly stopping them just because of the fear of contracting COVID is not a good thing to do. I think one has to be very careful about following the masking, social distancing, and hand washing, and quickly get your vaccines done. I think that is the way to protect oneself from COVID.
There has been also the whole post-COVID scenario where we hear that some people continue to have gastrointestinal symptoms. What is, in your experience, how the frequency, how long do they get these symptoms, or does it even happen to everybody? And what is the way forward on that? Should they contact the doctor and add some medication, or undergo some investigations perhaps?
So as we discussed, there are some upper abdominal discomfort, the bloating, belching. They all are seen in the initial phases of COVID. Most of them, about 90-95% of them, settle down during the course of the COVID infection, and as they recover from it, most of them are getting better. The usual period of diarrhea also is to the tune of about 4 to 5 days, beyond which the diarrhea also generally settles. But a small proportion, maybe let's say 5% or so or less than that, tend to have a little protracted course where they have diarrhea which persists beyond their time of discharge, or they have a significant loss of appetite and bloating and belching, which tend to persist in the post-COVID recovery phase also. Generally treat them with some symptomatic treatment to take care of their vomit, anti-nausea, anti-vomiting medicines, some enzyme supplements, and probably if they have belching, a lot of heartburn, and acid-suppressing medicine to take care of their symptoms, mainly symptomatic treatment. What we do see that in the next couple of weeks, generally the severity of these symptoms slowly regress and then they get better over a period of time. And as it is evident, and sometimes after a severe infection of the gut, leave alone COVID, even any other bacterial infection, as I told you, a small proportion, 3 to 5%, may have protracted time to get back to their normal, way of eating, or getting to have their normal stool back. That is what we call as a post-infectious irritable bowel. We do see a small proportion of people who are recovering from COVID have these symptoms, but generally they get better over a period of time. But what they have to look for in the period as they recover, as I told you, some patients, even after they get discharged, when they develop severe abdominal pain, or there is a lot of blood in the stools which is coming up, or black stools, I think that is not the usual post-COVID recovery symptoms. In that case, they have to definitely immediately contact their physicians again to see what needs to be done. Because some of the patients who are particularly, they have been admitted and they get discharged, they are also given some blood thinners. So sometimes these blood in the stools has to be watched out for, particularly during the recovery phase.
So while they're recovering, what would be your recommendation for a person to recover completely from all their gut-related symptoms? Is there anything that they should do in terms of either on their diet or on anything else that they could do to get better soon and get rid of all those symptoms?
I think following a healthy diet pattern is probably, that's what we would recommend. There is no special dietary precautions for the post-COVID recovery phase, but a healthy diet, as in it's a balanced, nutritious diet, is what we need to have. And generally, it helps if you avoid any deep fried and spicy foods during this recovery phase, and to have small, more frequent meals so that it doesn't overload the stomach at one go, and they have enough nutritious, balanced diet that goes along with it. There's no general recommendation to take any specific medicinal probiotics, but if people are happy to take their curd, and if they are curd and buttermilk, which are natural probiotics that we get along with our Indian food, I think that can also help them in the recovery phase.
Doctor, can you speak a little louder?
Yeah. So I think avoiding any deep fried or spicy food, having small quantum of food more frequently, and if you can add enough fruits, fiber, rich vegetables, and probiotics, natural probiotics in the form of curd or buttermilk, if that suits them, I think that will be a good way to improve their intestinal health.
Is there anything, any particular, apart from the deep fried, is there anything that they should avoid to not exacerbate the GI symptoms?
I would say if someone has diarrhea, if there are a lot of loose stools and stuff, and if they have, tendency to have loose stools after they take milk or milk-based products, probably avoiding milk as such could be one additional restrictions that we may suggest. But beyond that, I think what is important in the recovery phase is also to have a good balanced diet. So, unnecessarily restricting your food too much is also not good.
There has been some kind of maybe some speculation that, that because of the GI symptoms, COVID-19 can also spread through the orophageal route, through stools or through saliva or through food. So could you clarify this very common that many people have, Doctor?
Yeah. So right now, what is definitely accepted across the world is that the common mode of transmission is only through the secretions, through the cough and so on. But there have been early instances where we do find viral particles which are being shed, in the stools. So there has been concern that is there a possibility of COVID being transmitted through the orophageal route? And the virus, at least the viral, the RNA, the nucleic acid has been isolated from stool specimens and also sometimes from the restroom exhaust fans and other areas where they have taken swabs to see that whether that's still. But what we still have not shown is that we are able to isolate live viruses from the stool samples. So that is why it is not yet very clear whether actually COVID gets transmitted through a orophageal route. On the other hand, SARS-CoV-1, when it happened about 10 years back, they did an elaborate epidemiological investigation, and they found that people who are living in the same apartment complexes, who have not come in direct contact with each other, still ended up having COVID epidemic within that apartment complex. And when they looked at epidemiological investigations, they're looking at source samples to see where the virus particles are isolated. They did find that the common the exhaust route for these restrooms, lavatories to go through, also showed viral particles, so viral RNA. So there was some indirect evidence that may be a possibility that the virus is getting shed through the stools, and maybe one has to keep your closets, Western toilets and other stuff closed after we use, so that it doesn't come up through the aerosol, because there are common things which communicate in the apartment complexes. So, though we don't have direct live proof to say that there are live viruses which we are able to isolate from the stools, there is some epidemiological tools to say that there may be a small possibility which we may be able to transmit indirectly through the stool route. And as far as the salivary transmission and other things, they are very, very rare.
So, what precautions do you think anyway should somebody take if there is a COVID patient at home? Like, should they use a separate restroom if it's possible, or what kind of
exactly? If it is possible, I think
not everybody can do that. Yes.
In the isolation, then I think you should have a separate restroom for the 10 days when they are in the home isolation. In Indian settings, many times it is not possible. In that case, we should make sure that as soon as they as soon as they use the restroom, that area is sanitized well with disinfectant. Most importantly, they should, and the people who subsequently also use their hand sanitizer. You have to sanitize yourself, sanitize the seat which we use, and make sure that once they flush, it is always flushed in a closed way, that the commode is not open to air. So these are some small precautions, apart from the usual precautions that we take.
What about post-COVID? We were talking about a balanced diet, but there are a lot of people who for a long time say that they have a prolonged loss of appetite. They're not able to eat anything at all. So what is your advice, or will it get better, or is there anything they can do for that?
We do see people coming in about 10 days or 2 weeks after their recovery from COVID with symptoms. But generally, over the next few weeks, they get better. But if there's a prolonged loss of appetite, significant loss of appetite, I think we need to recheck their liver function test to see if there's any active liver inflammation. So that is something that we need to keep a watch on if it is prolonged loss of appetite. But generally, as I told you, most of them just regain their appetite over a period of next month or so.
We have also some questions which come to us, and I will just read them out, both from our live audience and some more questions. So this is about some people actually say that they have increased appetite during the post-COVID time. Is that normal, and does it usually happen? And is that something to be concerned about?
So the increased appetite is not just because of COVID. Sometimes when they recover from COVID, they are on some, or when they are treated for the COVID, they are on some medicines called as steroids if the lung involvement is high. So those medicines can actually increase the appetite, and as long as they are on the medicines, the appetite tends to be a little more than usual. So the medicines are tapered over a period of time. So during the time, I think generally the appetite also comes back to its original state. So sometimes it is because of the medicines that have been used to treat the COVID infection. If someone has a good appetite without the use of these steroids, I think that's just a bonus. I think they should be happy about it.
Enjoy it.
They should enjoy it, yes.
What about acidity issues after COVID infection? Is there some, I mean, we did talk about it, but should they see a doctor and try to get a prescription for any antacids or anything like that? Or is there any home remedy for it?
The acidity, yes. I mean, if it is very troublesome, a lot of belching, heartburn, or abdominal discomfort, pain with every meals or so, I think one has to be on prescription medicine which controls the acid levels, which cuts down the acid levels. Or sometimes you may need some medicines which help move the stomach a little better. And with that, with just some symptomatic medicines, generally the symptoms get better. But as I emphasized earlier, I think avoiding anything like a very fatty or spicy food, and that is very important. And having small amounts of food more frequently is also very important. I mean, that is a general recommendation that we give for all acid-related symptoms. I think that applies more so after the recovery from a COVID.
We'll just look at some questions which are coming to us on the live feed. I have serious constipation and shortness of breath. Please give me some suggestions, but this person does not say whether he's COVID affected or not. So I don't know. I suppose he's COVID positive.
COVID. Okay. Constipation, I think, can be multifactorial if he's short of breath and his physical activity is very limited, and if he's more like spends his time mostly on the bed or without much physical activity, that contributes partly to the constipation. Generally, adding a little bit of more fiber-rich diet, vegetables rich in fruit and vegetables, if they're able to take, should be good. Another common thing is when they try to strain to pass a stool, they become a little more breathless. So if it is very hard that they're not able to pass a stool easily, temporarily using some laxatives can be of help. So I think that they can discuss with the physician and then probably take a short course of laxatives and make sure that the stools are soft and he doesn't have to strain to pass the stools. I think that will help.
Another person also has been asking about overeating and feeling hungry very frequently after COVID, and also facing severe constipation, but we have already, I think, discussed about the appetite part of it. So that's next question is, my father is taking pain after taking food. He's also having constipation. Please suggest what can be done. But these people don't say whether they are actually COVID or gastrointestinal issues.
Yeah, the abdominal pain, if it is like mild upper abdomen after food, if it goes away within a few hours or so, then it's most likely a little acid-related issue that should be managed with some prescription medicines that cut down the acid level, as I explained earlier. If it persists as a very severe pain, then And if it is around the navel or lower down, with severe abdominal bloating, a lot of vomiting, I think that needs further evaluation and they have to contact their physician. If it is a mild pain which gets away, I think with some acid reducing suppressing medicines, generally they should get better. As far as the constipation, I think as I explained, probably a short course of laxatives, if the physical activity is very limited, probably will help them.
How to deal with indigestion after COVID-19?
There's no major difference between post COVID-19 or treatment for indigestion in the setting of a non-COVID patient. We have to choose and pick what food causes this. Sometimes they are allergic to certain foods, probably that precipitates indigestion. Generally, if they eat something very fried or spicy, I think that worsens this indigestion. And sometimes people feel they're constipated, they've not cleared their stools, that also contributes to the indigestion. I think we have to further probe as to what they mean by indigestion and probably treat it further.
For more than a month, having loose stools only in the morning, but I don't have COVID or any other problem or weight loss, but I don't want to visit a hospital physically. Please advise.
There's only loose stools once in the morning and subsequently there's no stools or just normal stools, then I wouldn't be too worried. If there's a lot of blood in the stools and if there's any significant pain, then that requires further evaluation. If you're having a habit of having some milk or milk products in the night, that can also contribute to having a loose stool in the early morning. So just review your dietary habits and see if that needs to be taken care of. If there are multiple loose stools, 4 to 5 times, more than a month, you're losing weight, there's some low-grade fever, or there's blood in the stools, I think that needs further evaluation. You don't have a choice, but at least to, come down to the hospital to see what needs to be done.
I'm in the 7th week of discharge from the hospital after recovering from COVID. While talking, I feel a pressure on the chest and throat. Please suggest what can be done.
While talking, you have a pressure in the chest and the throat.
I'm wondering, doctor, if this is a kind of a symptom where many people say they have a constricting feeling, probably maybe due to some oxygen lung fibrosis.
I think that is more to do with the lungs than I think with the stomach related issue. I think it's more to do with some exertion, something that causes them to have some discomfort in the chest.
I think they can consult the physician who treating them at the hospital will be able to help them. They might need some residual oxygen at home or something like that. So request to contact your doctor. Why multivitamins and zinc make loose stools after COVID recovery?
Multivitamins and zinc, well, if your physician has advised, it's okay, but it's just to improve your nutrition. Beyond that, there's nothing much. You can take a short course for about 2 weeks, no harm. Whether it improves your general recovery period, whether it improves the recovery, we don't know, but I think having a good short course of vitamins should be okay.
But they want to know whether that can cause loose stools after COVID recovery.
Generally
not. Sir, my father is a chronic kidney disease patient, having diarrhea, tried medications prescribed by the physician, but no recovery. Can you please advise?
If it has been more than 2 to 3 weeks, diarrhea is persisting, I think we need to consult a gastroenterologist, see what is happening. It may require further evaluation in the form of certain stool tests or a colonoscopy. I think we need to evaluate further if it is a persistent diarrhea lasting more than 2 to 3 weeks.
I think with that, we come to the end of this session. Thank you so much, Dr. Piramanayagam, for patiently explaining all the COVID and post-COVID gastrointestinal symptoms and complications. And thank you, viewers, for participating. It was really a very illuminating session. And we will now meet again on 18th June at the same time, where we're going to talk about COVID-19 lung damage and particularly the role of ECMO in recovery. And this is going to be discussed by Dr. T. Paul Ramesh, Apollo Hospitals, Chennai, Senior Heart Transplant and ECMO Specialist. He will be addressing us on the 18th of June at 2 p.m. Meanwhile, please subscribe to get the latest information on all the trending and relevant healthcare topics. Till then, take care, be safe, and remember the 5 W's of COVID-19 prevention. What? Follow COVID appropriate behavior. When? Every time. Where? Everywhere. Who? Everyone. And why? To stay protected from COVID-19, not only for you to stay protected, but also your family and loved ones. Thank you and namaste.
Thank you, madam. Thank you. It was wonderful interacting with us.
Thank you.